being a part of this helped me get through. I don't know what I would have done without these ladies. And they helped me and my family so much.
If I had to go back and do this all over again, I wouldn't do anything differently.
Anytime I needed them, anytime I had any questions or concerns, they were already there. So I really highly recommend Dr. Moody.
Feeling good about yourself, it doesn't matter how old you are. You know, it's always good to feel, you know, happy with your body.
I was diagnosed with breast cancer after having a biopsy. About a week later, I was admitted to the hospital to have my left breast removed. It was pretty devastating for me, but through prayer and support from my husband and family members and friends, I got through it somehow. I had been hearing some good things about a doctor in Anderson by the name of Dr. Moody. So I was advised to come in and see her and talk to her. And from the beginning, it was just wonderful. She was concerned about how I felt, and she wanted to know why did I want reconstruction. And I told her at that time my self-esteem was pretty low, and I didn't like wearing the prosthesis, and I thought that at this time, since I had been in remission for 6 years, that maybe possibly I could look into it. So about a month or two later, I had the left breast expander, which took, you know, several months, and after that, I got the reconstruction. I am so glad that I had my surgery. That was the best decision I made. It makes me feel so much better about me. My self-esteem is better, and I'm just so glad that I did make the decision to do it. People that are interested in getting this done, if you're a good candidate for it, it could be the best thing for you. It just seemed to change my attitude about a lot of things. I feel better. I don't shy away from talking about breast cancer. In the beginning I did because I knew that I didn't have reconstruction, and I didn't want to tell people that. But after reconstruction, I feel like I can inspire people and tell them that they can get through it. It's not the end.
Last year, I was diagnosed with breast cancer. I was 9 months pregnant, and I had a 2-year-old. And I actually was diagnosed on his birthday with him in the office with me and my husband. I knew I was going to die. I was 9 months pregnant, and I'd never even seen my unborn baby. So 4 days later, they induced me, and I gave birth to a beautiful baby boy, and he was healthy. And after that, I refused to talk about it for the first month. I wanted that whole first month to be just about the baby, and after that we started going to doctors and learning a little bit more about what I had to look forward to. They was concerned about why I was 24 and getting breast cancer, so they told me to go get a genetics test. And when I had that done, it came back that I had a cancer gene. So when I had the cancer gene, I automatically had to get a bilateral mastectomy, and I had to get a hysterectomy. After that, when I healed up from that, I started my chemo a week before my birthday. And then I started the chemo on Monday, and on Tuesday I went and got my head shaved so I wouldn't have to worry about the falling out. And then that lasted from November 30th until March 15th. That was my last chemo. And then after that was out of my system, I was able to come back to Dr. Moody and get the implants. I'm absolutely glad that I had the surgery, and I would definitely recommend this to anyone, whether they're in my situation or not. Dr. Moody was excellent. Last year this time, I thought I was gonna look, all tore up, but I really, really am happy with the way I look so far, and I'm so excited to see how I'm gonna look when it's all done.
At the age of 34, I was diagnosed with invasive tubular breast cancer. After talking to my surgeon and actually another doctor in radiology, they encouraged that I really need to consider a mastectomy. So at that time, my surgeon told me about Dr. Moody and actually set me up an appointment immediately to come talk to her. So actually the very next day, I came to meet with Dr. Moody, and the first person I met was Kathy, and she brought me back, and she's actually a breast cancer survivor herself and her daughter, and she sat with me and talked with me and cried with me, and that was just good to have, to have that, because you always want to hear about survivors. And so they scheduled the surgery. It was about a week and a half later, I believe. And actually my surgeon and Dr. Moody were there together. My surgeon did the mastectomy, and when he finished, Dr. Moody put in place the tissue expander. So about 6 months after the mastectomy, I had the reconstruction. Dr. Moody went in and took out the tissue expander, put in a permanent implant, and did an augment on the other side to make them more even, and I was very pleased. It looks great. I mean, no one would even know that I'd had breast cancer and had a mastectomy. I've actually been asked by several ladies, I've made some friends through all this that are now going through breast cancer, and they have actually said, am I too old to do this? And no, I don't believe that at all.
My name is Kristen Williams, and I was diagnosed with breast cancer September 11th of 2008. It was quite a day to remember. I was shocked. I was in the best shape of my life. I was training for a half marathon, just eating right, feeling great. It was quite a shock when I was diagnosed with stage 3 breast cancer. My type of breast cancer is very aggressive. It's called triple negative. So we wanted to start chemo as soon as possible. So on October 8th, I had a right breast mastectomy and a lymph node dissection. And after that, I just, you've had your breast removed, you've lost all your hair, you've lost your eyelashes, you've lost your eyebrows. I felt that breast reconstruction was the way that I needed to go to feel whole again, emotionally and physically. I talked with Dr. Moody about several different types of reconstruction and decided that I wanted to move forward with putting in an implant, and we decided to go with a silicone implant. So I went in to get my expander. The expander took about 2 hours. I was in and out. I did not have much pain. Everything went very smoothly, and Dr. Moody was very explanatory about what we'd be doing following that procedure. I felt very prepared for the procedure that we were getting ready to undergo, first the expansion, and then 3 to 6 months later, depending on my healing process, the full reconstruction of the right breast. I felt like I had all the facts, that Dr. Moody had been very upfront, very detailed with everything that would go on, everything that would happen, the time frame that she needed between each surgery. Dr. Moody is certified by the American Board of Plastic Surgery, and whether you use Dr. Moody or not, you should definitely make sure that you have a certified doctor. That's very important. You want to make sure that they are up to date on all the new procedures, all the new guidelines, because this is your body and this is what you're going to have for the rest of your life. So I would highly recommend Dr. Moody. Her staff is wonderful. They were always very personal. They call me by name every time I walk in the door. Very upbeat about everything, and they were always very complimentary of Dr. Moody. So when your staff is complimentary of you, I tend to think you must be a fairly good doctor and a good person.
I highly recommend Dr. Moody. She was so professional, she's very knowledgeable, she's concerned about your feelings, and I just enjoyed the whole experience with her and her office staff. They were all wonderful.
I absolutely recommend Dr. Moody to anybody. She is serious, but she is very, very specific and very good, and she lets you know from the start, what's going on, what's going to happen, and she's just very precise, and she, again, did a great job.
I definitely recommend Dr. Moody, highly recommend Dr. Moody, and I tell everyone, even if you're just looking to have plastic surgery, you need to go talk to Dr. Moody. I felt, after both of my surgeries, I felt like I was in the best care. I mean, she is so on top of things, and I didn't have to worry about anything because I knew she was going to take care of it.